Assalamu alaikum and welcome to this lecture on the role of infection control in patient safety. Infection control is at the heart of patient safety and at the heart of keeping our patients safe. And we will go into, in this lecture, during this lecture, we will go into this a little bit more in details and look at what is our role in infection control and what is the role of the organization, the hospital, the management, the system in infection control. So worldwide, we have around 100 million patients that are affected by healthcare-associated infections, or HAIs, every year. This is the most frequent adverse event in medicine, and there's a high discrepancy between low-income countries versus high-income countries, or low and middle-income countries versus high-income countries. So you can see that in high-income countries, you have about 7.6% of patients admitted to hospital suffering healthcare-associated infections, while in low and middle-income countries, it's 19.2%. Surgical site infections in particular is also a big difference. You have 5.2% in high-income countries and almost double or more than double in low and middle-income countries. And also healthcare-associated infections on ICU are more frequent in low and middle-income countries. In Palestinian hospitals too, you have around 1 in 7 patients that are admitted to Palestinian hospitals who come to harm during their admission, and a significant number of those actually suffer from infections. This was a study done in 2013 by Najar et al. And in West Bank hospitals. You can see in this study they used a global trigger tool to find out, to identify patients who came to harm during their admission, and they found that almost 60% of these events had actually been avoidable. So the urgency of looking at healthcare-associated infection lies, of course, in the increased morbidity and mortality that patients suffer, but secondly also it lies in the fact that antibiotics are no longer the magic bullet which can cure everything. We find, especially in healthcare-associated infections, an increasing number of infections that are due to organisms which are actually not sensitive to antibiotics. So therefore, we find that patients stay longer in hospital, they actually die more frequently, they are treated with toxic and less effective drugs, and they are prone to surgical site infections too. So what are the main causes of healthcare-associated infections? Have a quick think about that before you continue this lecture. So the main causes lie in person-to-person transmission of healthcare workers to patients and also to visitors. This is the most frequent situation that happens. Also significant but less important roles play personal equipment such as stethoscopes or personal digital assistants and clothing that might be transmitters of infection. Sometimes you have environmental contamination. Airborne transmissions are, of course, important. Carriers on the hospital staff and rare common source outbreaks are also important. This could, for example, be a Legionella outbreak in a hospital where Legionella has infected the ventilation system or is in the ventilation system, and then you find in this hospital an outbreak of this Legionnaires disease. The single most effective intervention to reduce the spread of infection is effective hand hygiene. And also within the context of the coronavirus COVID-19 pandemic, you have heard a lot about hand hygiene and the importance of hand hygiene. This can either be done by soap and water or with alcohol-based hand rub. Only water is not enough to clean your hands properly of germs, as you need the soap or the alcohol to disrupt the organism's phospholipid membranes and actually kill viruses as well as bacteria on your hands. Here you have two people who have been credited to kind of work for infection control and promote infection control measures in the 19th century in Europe. One was Ignaz Semmelweis. He was an obstetrician, a Hungarian obstetrician, who worked in the Vienna Royal Hospital. And there he kind of noticed that when medical students were on his labor ward, the infection rate amongst women and also their death rates actually increased to times when there were no medical students on the ward. Then he noticed that those medical students often came from dissecting corpses for their learning directly to the labor ward, delivering women, examining women without washing their hands. So at the time, people had not realized yet, or that actually germs were the transmitters of possible diseases. So he was a little bit in front of his time when he made it mandatory for everybody on his labor ward to always wash their hands when they entered the ward, when they examine a woman, and after they have examined a woman. So he made this mandatory, and he could see in kind of minutely registered numbers, he could show that this reduced the infection rates and the morbidity, the mortality, and the morbidity due to infection on his labor ward. The second person on this slide is Florence Nightingale. Florence Nightingale was a nurse who worked in the Crimea War. In the Crimea War, 18,000 British soldiers died, but only 2,000 on the battlefield. The rest died as a result of their wounds, and many of them due to infection. She came to look after these wounded soldiers and found them in crowded, dirty hospitals, no light and no order in them. And she changed the wards. She made them clean and orderly, put space between the beds, and ensured that there was new linen, washed linen, all the time ready for these soldiers, these sick, recovering soldiers. And with that, she was actually able to also show in numbers that this reduced morbidity and mortality among these soldiers. She could take these numbers and send them to Whitehall, and there they were they convinced the politicians to give her more funds for laundry facilities and more nurses to look after these soldiers to improve their kind of chances for a safe survival. In the Islamic world, they actually knew about this kind of connection between cleanliness and reduced infections 1,000 years earlier than they knew in Europe about it. It was Zakaria Razi who had already kind of put in place important measures such as cleaning on the wards, using mercury as a wound kind of cleaning agent, as mercury is actually an antiseptic and microcidal kind of substance. And he put these into, and kind of the other thing that was kind of important at the time is that there were very high hand hygiene standards within the Islamic world. And this already was known and common practice in the Islamic world at the time. But what is the situation we have in Gaza? The Ministry of Health adopted an infection prevention and control protocol in 2004, but the adherence to this protocol among healthcare workers remains poor. In 2010, a study was performed looking at the adherence and also just the awareness of this protocol, and they found that only 45% or almost 46% adhered to the hand washing, 40% roughly adhered to wearing gloves when indicated, and only around 50% used antiseptics and disinfectants to clean their hands. A similar an audit on the hand washing audit on the on one of the obstetric units showed that hand washing compliance was similar, around 46%. And at the time, doctors who saw patients and wanted to wash their hands had to actually go into patients' bathrooms to wash their hands, because there was no disinfectant available to just quickly wash their hands between seeing patients. And this, after following this audit, this was actually provided to the wards, on all wards, and this increased hand washing practice and to about 64%. Also not better, much better, but since then a lot of interventions have been done, and also re-audit has been done, and this is constantly improving this hand washing practice on this specific obstetric unit. Similarly, a large number of studies and have now been done. One was done and published by El Shami in BMC Surgery in 2020, and this showed that supplies were often poor, so that hand scrubbing had to be done with povidone solution rather than the more effective chlorhexidine solution. Also practice around oxygenation, so practice around preventive measures, the application of preventive measures for surgical site infection, or to reduce the incidence of surgical site infection, was kind of a bit sketchy. So, for example, perioperative oxygenation with 80% oxygen, which is known to reduce surgical site infection, was only done in 50% of patients. Similarly, irrigation of the wound with iodine prior to closure was not done, was only done a few times. Then also one other feature which was quite shocking in this piece of research was that about 66% of cases still underwent shaving prior or even within the in the surgery theater, which is absolutely shown to not reduce infection rate but to increase infection rates, and therefore should really not be done unless there's absolute necessity for it, for very much for extreme hairiness. So these were all practices which were shown not to be followed properly within this study. So what are the factors leading to poor adherence, to such poor adherence in Gaza? It is, of course, a lack of awareness and a need for education of staff. Into the study in 2010 that looked at the protocol that had been adopted by the Ministry of Health showed that only 2.3% of participants in the study had actually had a copy of this infection prevention and control protocol, and only 65.8% actually knew of its existence. So there's a big gap here from even staff who had looked at the protocol, and even also from staff knowing about the protocol. Furthermore, you have poor facilities and supplies, and also sometimes you have lack of time, and workload is kind of viewed as an obstacle for following proper procedures in infection control. So what needs to be done to kind of make this change the situation? First of all, it is very important that hospitals are kept visibly clean. Okay, so there should always be visibly clean, and during times of specific disease outbreaks, the cleaning has to be even increased and intensified. The use of hypochlorite and detergents during outbreaks is very important in this. Okay, and here you can see on the left hand a picture of cleaning of just a normal ward, and on the right side a deep cleaning of operating theater following a contaminated procedure, so a procedure with a contaminated surgery field. Also, it is of course very important to actually follow the hand washing advice. So to know how to clean your hands, to understand the rationale and choice or to clean your hands, to look at the technique for hand cleaning, to make sure you know what is good as contaminants for hand cleaning, and also to promote adherence to hand hygiene guidelines. The WHO advises actually 5 or 7, depending on how you count it, moments of hand hygiene. Okay, so these are the moments to wash your hands. This is always before touching any patients. You should always wash your hands. This can be, if your hands are already visibly clean, this can be just with alcohol rub. Also, before a clean or aseptic procedure, you have to wash your hands. Even if you wear gloves, before putting on the gloves, it's very important to also wash the hands. After contacting bodily fluids or secretions, after touching a patient, after touching the surroundings of a patient, and also upon entering and leaving a room, you have to always wash your hands. The second important practice is to actually use protective equipment. Recently, the coronavirus, we have had a lot of discussion around personal protective equipment. Now we're just talking about normal protective equipment, what to use in a normal kind of situation. Sometimes you have to use face mask and goggles, but not always. But in a lot of cases, you have to use gloves. And unfortunately, here you see quite often that healthcare providers take bloods without using even gloves. Okay, but it is very important. Taking blood is an invasive procedure. You have to wash your hands before you do it, and you have to wear gloves while doing it. Other protective equipment might be aprons if you do something dirty, face masks or protective glasses. And you can also have the full suit. This is, of course, in cases of outbreaks of highly infectious viruses or bacteria, such as the coronavirus. A second very important part of keeping the workplace safe, also for yourself and also for others, is to always dispose all of your sharp items directly into a sharp bin. This includes needles, venflons, anything that surgical knives, anything that has been that can kind of penetrate the skin of people. It is important also, not for your own safety, it is important for people who afterwards clean the area, or those who kind of take away the rubbish. If you put a needle into a normal rubbish bag, it will kind of penetrate the rubbish bag and a domestic cleaner might come to harm and get a needle injury. So you have to always keep handling sharps to a minimum. You should never recap needles, never bend or break them after use. You have to discard each needle into a sharps container at the point of use. You should never overload a bin if it is full. And you have to leave sharps boxes or bins out of the reach of children, of course. So how can such exemplary practices be implemented? It would need multimodal intervention and continuous kind of reminding yourself, staff, teams of implementation of such infection control practices. It requires regular education of staff. It also requires education of the public. It, of course, requires a provision of adequate facilities and supplies, such as hand washing facilities in each patient room, alcohol dispensers outside of patients' rooms, surgical scrubbing solutions, sharps boxes, and also have to be easily available to staff and public. Actually, the minimum is that the healthcare providers are aware of the existing protocol, infection control protocol, and also it needs a degree of enforcement of such a protocol. So in Gaza, you still have a high rate of violation to the protocol. Although most people know what is correct practice, they do not follow it. Why is this? There's a lack of professionalism among healthcare staff around this, and a little bit sometimes a risky behavior or cavalier behavior around these issues. There's maybe a lack of culture of clean hands, and also a lack of enforcement of protocols. Let us quickly talk about define error and violation. Okay, so an error, and we talked about errors before in our last briefly, I think, in my last patient safety lecture. An error means when you're doing something wrong when you were meaning to do the right thing. So you do the wrong thing while meaning to do the right thing. A more formal definition is a planned sequences of mental or physical activities that fail to achieve their intended outcomes, when these failures cannot be attributed to the intervention of some chance agency. Okay. So what is then a violation? A violation is a deliberate deviation from an accepted protocol or an agreed standard of care. Okay, so it's a deliberate violation. It's not when you actually mean to do the same thing, but when you deliberately not do the right thing. And this you can see actually sometimes on a daily basis within hospitals. And you might come to view a lot of violations to infection control protocols. You might see a doctor seeing one patient and then the next without washing their hands, walking into patient's room without cleaning their hands with alcohol rub first, and so on. So you might actually come to witness such actions. It is therefore very important to be aware of your own individual responsibility. First of all, you have to take on individual responsibility. Okay, so even if nobody else cleans their hands before taking bloods from a patient, you have to make sure you clean your hand with alcohol rub before actually seeing a patient. You have to apply universal precautions, and you should always be immunized against hepatitis B. You should always use personal protection methods such as gloves when taking bloods, for example, or putting in venflons. And you have to know what to do if you have been exposed. And you should also encourage others to use universal precautions. But there's also a responsibility and a role for the organization in this. So first of all, guidelines and policies have to be agreed and drafted and adopted. Hand washing facilities have to be provided. Disinfectant gel has to be available in every patient room. Staff have to be trained regularly, and awareness campaigns have also got to be run to make also the public aware of this important issue. Finally, in order to keep a track of what's actually happening on the ground, you have to do regular audits to kind of make sure you keep on improving the practice and keep on going for the best quality service deliverable. So you have to do regular hand hygiene audits. You should do regular audits to see if the surgical site infection prevention measures are followed or not. And if you find weaknesses, you can then target those weak areas and kind of improve the practice. This is an example of such an audit. On the left side, you see one nurse doing the audit and looking at what the other nurse actually is doing. And you can see on the right side, you can see a bar chart. And here you can see in one hospital, they kind of show the adherence rates to hand washing. Okay, and they look at nurses, healthcare professionals, and doctors, and see what are the adherence rate on each of the wards. You see the name of the wards at the bottom, and you can see that actually doctors are not doing very well here. They are all below 50% with their adherence rates, and nurses and healthcare assistants actually do much better. This is an example of awareness campaigns. You can see this is the entry of a ward, and before the entry to the ward, you can see this hand gel dispenser on the wall. And next to the hand gel dispenser, there's a sign which clearly asks all visitors, all people who enter the ward, to, before they enter the ward, stop, think, and wash their hands. In this case, with the provided alcohol wrap. So what can you personally then contribute to minimize infections? Actually, there's a lot of things you can do, and you should always stick to. First of all, you have to examine your own actions before contact with each and every patient. You should wash your hands, and also before every aseptic task, you have to wash your hands. Similarly, after each contact to a hand, you should to a patient, you should wash your hands after contact with body fluids. You also, or patient surroundings, you have to also wash your hands. Students might observe routinely staff who apply inadequate techniques in hand washing, who fail to wash their hands, or who routinely violate correct infection control procedures. In this case, it is important not to follow the staff and do the same. It is actually important, to stick to the correct procedures. Have your hand gel, if there's no hand gel on the ward, have your own hand gel with you in your coat pocket, so that you can always look and show, no, I'm actually washing my hands before I enter this room, after I leave the room, before I touch the patient, after I touch the patient. And this makes a good example and reminds other staff to also adhere to such procedures. So, infection control practices are paramount to prevent healthcare-associated infections. It is an individual as well as an organizational duty to adhere to local guidelines. Multimodal intervention will help raise infection control standards, and will help enforce practices and correct practices of infection control. And this has to include education of the staff, education of the public, ongoing monitoring and feedback, clinical audit, development of professionalism of healthcare staff, and also leadership on this issue by managers and regulators. Finally, I wonder, which hands are yours? Thank you very much for listening, and always remember to wash your hands.